We often come across patients who complain about missing teeth. So let's understand what happens when a tooth goes missing. As we all know, once a tooth is lost, there is a space that has been created. So when you eat food, there is difficulty in chewing. And as the food is impacted over there, the gums also get infected. Now because there is a space that is available, the adjacent teeth as well as the teeth that is placed above it will start drifting to that position. The spaces that were closed earlier are now open and the food goes and gets stuck within them. Once the food has been stuck there, it leads to cavity. After there is a cavity that is present, there is more plaque accumulation and calculus, which leads to gum infection. After gum, the infection is going to proceed to the bone. Once the bone that was supporting the tooth is lost, the tooth starts moving. The mobility then leads to lots of pain and further complications. Because the occlusion is now hampered, there are going to be further complications. And that is the reason replacement becomes very important. So to know more about how can this replacement be done, stay tuned for part 2.